Now, how do you stop a public health concern becoming a public panic? In the past, the emergence of diseases like SARS or bird flu hit the headlines and kind of everyone reacted. Well, now the World Health Organization is meeting to discuss the outbreak of another virus, this time known as MERS. But what exactly is it, and just how worried should we be? So, Middle East Respiratory Syndrome. Well, joining me now is Professor David Heyman, Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine. Welcome to you. Thank you very much.
Thank you.
So, how concerned should we be?
Well, whenever there's a new virus, such as MERS coronavirus, we should be very concerned because we don't know what this virus will do in the long term. It could mutate, it could change in such a way that it becomes a disease which stays with humans till the end of time.
I phrased it in the introduction that how do you stop concern about public health becoming a panic? I mean, that is always the difficult issue about calibrating what people like yourself say about these things, isn't it?
It is very difficult, and at the start, because so little is known about an organism, the measures to prevent its spread must be quite draconian. And then as more information is obtained, and it's understood the source of the virus and how it's transmitted, the recommendations can change.
So we said there have been a number of cases of MERS. What sort of impact has it had on people? How do you come into contact with it? How is it transmitted?
Well, those are the questions that people are trying to understand right now. Unfortunately, the studies that could tell how it's transmitted to humans have not been done. They need to be done, they will be done, we understand, but they haven't been done yet. We know that there are animals in nature that are infected. For example, dromedary camels appear to be infected. But if they're infected, are they the source of the infection to humans, or have humans infected them? And if they are the source, how is it transmitted from dromedaries to humans?
And when you say those tests are going to be done, does what, I mean, you know so much more about this, how long does it take? I mean, or is that how long is a piece of string?
Well, they should have been done earlier, but they haven't been done. For example,
why is that?
Well, it's not clear why they haven't been done, but for example, in the outbreak of SARS, the outbreak investigation was done within a very short period of time by a collaboration around the world. And it was clearly understood how the virus was transmitted and how to stop its transmission. As of today, we don't know, with 500 cases of MERS, how it really is arriving into human populations.
Isn't it right that, I mean, what I was just reading in research before doing this interview with you, that, it's people who are in hospital where there's very close contact medical workers getting it as well?
That's right. What happens is somehow humans become infected from nature, and then close contact with those humans in hospital settings where there are body secretions or other blood or other parts of the human body that come in contact, there can be infection of health workers and close family members.
But for the moment, no vaccine for anything like this?
There's no vaccine for a disease such as this. This is a new infection previously unknown in humans until 2 years ago.
David Heyman, thank you very much for shedding as much light as you can on it. Maybe we'll have you back when maybe those tests have been done and we know a little more.